And we pray that today you'll guide our professor and give us understanding as we will have another class. We ask for your guidance and grace, O Lord, for we are nothing without you. This is all we ask and pray in Jesus' mighty name. Amen. In the name of the Father and of the Son and of the Holy Spirit. Amen.
Okay, thank you, AJ, for that nice prayer. Good afternoon, everyone.
Good afternoon,
Good
Miss.
afternoon, Miss.
Good
Afternoon, Miss.
afternoon, Miss.
Okay, so may we ask the PhilHealth cluster to start na?
Yes, Miss.
Good day, everyone. This is Cluster 1 from Group 2, and today in this report, we will be discussing about PhilHealth. And just to be specific about the topics that we will be discussing today, this is a short overview. First, we will be discussing about the PhilHealth membership and contribution. Second, we will be discussing about the PhilHealth healthcare institutional accreditation. Third, the third topic will be the PhilHealth benefits. And lastly, we will summarize everything. So all of the topics here today.
So for the PhilHealth membership and contribution, we have here Republic Act 7875 as amended by Republic Act 10606, including functions and powers of PhilHealth. Before we dive into the functions and powers, we must first understand what is Republic Act 7875. The National Health Insurance Act of 2013, also known as Republic Act 7875, as amended by Republic Act 9241 and 10606, aims to provide affordable and accessible health care services to all Filipinos. To ensure the effective and efficient implementation of this law, the government has issued revised implementing rules and regulations, or IRR, that outline the specific policies and procedures to be followed by the Philippine Health Insurance Corporation, also known as the PhilHealth. So the National Healthcare Insurance Program was established to provide health insurance coverage and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. It shall serve as the means for the healthy to help pay for the care of the sick, and for those who can afford medical care to subsidize those who cannot. It shall initially consist of Program 1 and 2 or Medicare and be expanded progressively to constitute one universal health insurance program for the entire population. The program shall include a sustainable system of funds constitution, collection, management, and disbursement, the availment of a basic minimum package and other supplementary packages of health insurance benefits by a progressively expanding proportion of the population. The program shall be limited to paying for the utilization of health services by covered beneficiaries. It shall be prohibited from providing healthcare directly, from buying and dispensing drugs or pharmaceuticals, from employing physicians and other professionals for the purpose of directly rendering care, and from owning or investing in healthcare facilities. So, PhilHealth is a tax-exempt government corporation attached to the Department of Health for policy coordination and guidance. It shall have the following powers and functions. So this is from Article 4, Section 16 of Republic Act 7875 as amended by Republic Act 10606. So A is to administer the National Health Insurance Program, B to formulate and promulgate policies for the sound administration of the program, C to supervise the provision of health benefits and to set standards, rules, and regulations necessary to ensure quality of care, appropriate utilization of services, fund viability, member satisfaction, and the overall accomplishment of program objectives. D. To formulate and implement guidelines on contributions and benefits, portability of benefits, cost containment, and quality assurance, and healthcare provider arrangements, payments, methods, and referral systems. E is to establish branch offices as mandated in Article 5 of this Act. F is to receive and manage grants, donations, and other forms of assistance. G is to sue and be sued in court. And H is to acquire property, real and personal, which may be necessary or expedient for the attainment of the purposes of this Act. So I is to collect, deposit, invest, administer, and disburse the National Health Insurance Fund in accordance with the provisions of this Act. J is to negotiate and enter into contracts with healthcare institutions, professionals, and other persons, juridical or natural, regarding the pricing, payment mechanisms, design and implementation of administrative or operating systems and procedures, financing and delivery of health services in behalf of its members. K is to authorize local health insurance offices to negotiate and enter into contracts in the name and on behalf of the corporation with any accredited government or private sector health provider organizations. including but not limited to health maintenance organizations, cooperatives, and medical foundations, for the provisions of at least the minimum package of personal health services prescribed by the corporation. L is to determine requirements and issue guidelines for the accreditation of healthcare providers for the program in accordance with this act. So M is to visit, enter, and inspect facilities of healthcare providers and employers during office hours, unless there is reason to believe that inspection has to be done beyond office hours, and where applicable, secure copies of their medical, financial, and other records and data pertinent to the claims, accreditation, premium contribution, and that of their patients or employees who are members of the program. N is to organize its office, fix the compensation of, and appoint personnel as may be deemed necessary and upon the recommendation of the President of the corporation. O is to submit to the President of the Philippines and to both houses of Congress its annual report, which shall contain the status of the National Health Insurance Fund, its total disbursement, reserves, average costing to beneficiaries, any request for additional appropriation, and other data pertinent to the implementation of the program, and publish a synopsis of such report in 2 newspapers of general circulation. And P, to keep records of the operations of the corporation and investments of the National Health Insurance Fund. Q is to establish and maintain an electronic database of all of its members and ensure its security to facilitate efficient and effective services. R is to invest in the acceleration of the corporation's information technology systems. S is to conduct information campaign on the principles of the NHIP to the public and to accredited healthcare providers. This campaign must include the current benefit packages provided by the corporations, the mechanisms to avail of the current benefit packages, the list of accredited and disaccredited healthcare providers, and the list of offices or branches where members can pay or check the status of paid health premiums. And T, to conduct post-audit on the quality of services rendered by healthcare providers. So, U is to establish an office, or where it is not feasible, designate a focal person in every Philippine consular office in all countries where there are Filipino citizens. The office or the focal person shall, among others, process, review, and pay the claims of the overseas Filipino workers, or the OFWs. So V, notwithstanding the provisions of any law to the contrary, to impose interest and/or surcharges of not exceeding 3% per month, as may be fixed by the corporation in case of any delay in the remittance of contributions which are due within the prescribed period by an employer, whether public or private. Notwithstanding the provisions of any law to the contrary, the corporation may also compromise, waive, or release in whole or in part such interest or surcharges imposed upon employers, regardless of the amount involved under such valid terms and conditions it may be prescribed. W is to endeavor to support the use of technology in the delivery of healthcare services, especially in far-flung areas, such as but not limited to telemedicine, electronic health record, and the establishment of a comprehensive health database. So X is to monitor compliance by the regulatory agency with the requirements of this act and to carry out necessary actions to enforce compliance. Y is to mandate the national agencies and the LGUs to require proof of PhilHealth membership before doing business with a private individual or group. And Z is to accredit independent pharmacists and retail drug outlets and AA, lastly, to perform such other acts as it may be deemed appropriate for the attainment of the objectives of the corporation and for the proper enforcement of the provisions of this act. So, by knowing about the powers and functions of PhilHealth, Filipinos can make informed decisions about their healthcare needs and take advantage of the benefits and privileges provided by their PhilHealth membership. It also empowers individuals to hold PhilHealth accountable for fulfilling its mandate and to participate in shaping the country's healthcare policies and programs. So now let us proceed to the types and categories of PhilHealth membership. So PhilHealth offers different types of memberships and categories for members to cater to the various needs and sectors of the Filipino population. These memberships ensure that all Filipinos have access to affordable and quality healthcare services regardless of their socioeconomic status and employment status. The following table presents a detailed overview of the various types of PhilHealth memberships to facilitate a better understanding of this critical aspect of the National Health Insurance Program. So now we have here the different types of PhilHealth membership, premiums, enrollment, and payment. So for formal membership, its premium is employer and worker each pay half up to 2.5% or maximum of 3% of income up to 10,500 pesos. Its enrollment is as of the hire date and payment is 3 months. Indigent membership is 2,400 annually. Its enrollment is through the national government and payment is none. Sponsored membership is 2,400 annually. Its enrollment is through the local government and payment is none. Lifetime membership is their premium is free lifetime coverage and then enrollment is for the retirees and pensioners and payment is none. For senior citizen membership, they are non-paying as according to Republic Act 10645 and they have a free lifetime coverage. Enrollment is for people aged 60 years and up and payment is none. For informal membership, their premium is 2,400 pesos annually for members earning 25,000 and below 3,600 pesos annually for members earning more than 25,000. Their enrollment is the enrollment date and payment is none. For OFW land-based membership, their premium is 2,400 annually and their enrollment is at the immigration date and they have no subsidy. Payment is on the immigration date then annually. For OFW C-based membership, their premium is employer and worker each pay half up to 2.5%, maximum of 3% of income up to 10,500 pesos, and enrollment is as of the hire date and payment is 3 months. So now we have the categories of PhilHealth members. First one is the formal economy members. This pertains to all employed individuals working in the government or private sectors with offices based in the country. This also covers seafarers in considering their agencies are in the Philippines. So contribution payments for formal economy members is monthly 3% contribution. The employer and employee will each pay half of the premium. So next one is the informal economy members, include those who are unemployed, self-employed, informal workers, market vendors, small construction workers, and etc. Naturalized Filipinos and foreigners living in the Philippines who are voluntarily or individually paying their premium. Their contribution payments is monthly 3% contribution, pay the full premium amount. For overseas Filipino workers, C-based OFWs follow the formal economy membership's monthly contribution as they are bound by the employer-employee relationship. Their contribution can be made every 3, 6, or 12 months. So we have here senior citizens. These are Filipinos aged 60 years and above who do not belong to any membership category and are automatic members of PhilHealth as stated by the Universal Healthcare Law of 2019. The national government covers their annual premiums. And now we have here lifetime members, those aged 60 years and above who has paid a minimum of 120 monthly premiums with PhilHealth. Their membership becomes free once they reach 60. And now we have here sponsored members. These refers to members whose contributions are shouldered by a sponsor, which can be a private individual, the local government, a government agency, or a private agency. Sponsored members can include low-earning citizens who are not indigent, such as barangay health workers and volunteers, nutrition scholars, persons with disabilities, and unenrolled pregnant women, among others. So their contribution payment is sponsor covers their fees. So indigent members pertains to members without a source of income or insufficient household income based on DSWD or the Department of Social Welfare and Development specific criteria. Their contribution payment is covered by the government through its National Health Insurance Program. And lastly, we have qualified dependents. Those whose contributions are declared and covered by a principal member. Those could be the member's legitimate spouse, children, or parents. Qualified dependents must be listed in the PhilHealth Contributors Member Data Record or the MDR to access the benefits. So for their contribution payments, PhilHealth member is responsible for paying the corresponding premiums for each of their qualified dependents. So now let us move on to the process of becoming a PhilHealth member. So becoming a PhilHealth member is a straightforward process that involves a few simple steps. Whether you're a first-time applicant or renewing your membership, this guide will provide you with all the information you need to become a PhilHealth member and take advantage of its many benefits. In this article, we'll walk you through the step-by-step process of becoming a PhilHealth member. So before we tackle about the registration procedures, we must first know who are the members of these economies. So the first member of the formal economy are the government employees, which are employees of the government who render services in any of the government branches, military or police force, political subdivisions, agencies, or instrumentalities, including government-owned and controlled corporations, financial institutions with the original charter, constitutional commissions, and is occupying either an elective or appointive positions, regardless of the status of appointment. The second one is the private employees, which are corporations, partnerships, or single proprietorships, NGOs, cooperatives, and nonprofit organizations, social, civic, or professional or charitable institutions organized and based in the Philippines, including those foreign-owned, foreign governments, or international organizations with quasi-state status based in the Philippines, which entered into an agreement with the corporation to cover their Filipino employees in PhilHealth. So owners of micro enterprises refers to owners of the business with total assets of not more than 3 million pesos and with less than 10 workers. Owners of small, medium, and large enterprises refers to owners of business with total assets of more than 3 million and with at least 10 workers. For household help, these refers to employees who render domestic services in households for compensation as defined in Republic Act 10361 or the Kasambahay Law. For family drivers, these refers to drivers who are employed by households to operate household-owned or household leased vehicles for the family's personal use. So now we have here the qualified dependents. So number one, the legitimate spouse who is not a member. Number two is child or children, legitimate, legitimated, acknowledged, and illegitimate as appearing in birth certificate. Adopted or stepchild or stepchildren below 21 years of age, unmarried, and unemployed. Number three is children who are 21 years old or above but suffering from a congenital disability, either physical or mental, or any disability acquired that renders them totally dependent on the member for support as determined by the corporation. Number 4 is foster child as defined in Republic Act 10165, otherwise known as the Foster Care Act of 2012. So number 5 is parents who are 60 years old or above, not otherwise an enrolled member, whose monthly income is below an amount to be determined by the PhilHealth in accordance with the guiding principles set forth in the NHI Act of 2013. And lastly, parents with permanent disabilities regardless of age as determined by PhilHealth that renders them totally dependent on the member for subsistence. And now let us move on for the registration procedures of the formal economy members. So for newly hired and existing employees without PIN yet, step 1 is to fill out 2 copies of the PhilHealth member registration form or the PMRF, and then step 2 is to submit PMRF to the HR department of the employer. Step 3 is to await member data record and PhilHealth ID card for an employer. For newly hired employees with PIN, step 1 is to report your PIN to your employer for them to indicate the same in their ER2. And for the premium requirements, premium contributions are shared by the employee and the employer, the amount of which is determined based on the new premium contribution rate. After deducting half of the premium requirement from your monthly salary, total premiums are remitted by your employer to the PhilHealth. So in amending your data, you need to step 1, download the PhilHealth member registration form or PMRF. Step 2 is to tick for updating on the upper right hand corner of the PMRF. And step 3 is to fill out PMRF as appropriate. And step 4 is to submit properly filled out PMRF to the nearest PhilHealth office. And step 5 is to await printout of updated member data record. So for continuing your coverage, if leaving formal employment to venture into self-employment, you need to step 1, request for amendment of membership to become a self-earning individual, declare your monthly income, and pay the required premium at any PhilHealth office or accredited payment center or through the PhilHealth member portal. Step 2, the premium contribution shall be based on the declared income. And step 3, payment can be made monthly, quarterly, semi-annually, or annually. If seeking employment as a land-based overseas Filipino worker, indicate existing PhilHealth identification number or PIN when processing registration and payment to PhilHealth as a migrant worker. If already at the age of retirement, have contributed at least 120 monthly premiums, and is not gainfully employed, register under the Lifetime Member Program. And now let us move on to the informal economy. These are the members. So migrant workers, documented or undocumented Filipinos who are engaged in a remunerated activity in another country of which they are not citizens. Informal sector includes among others street hawkers, market vendors, pedicab, and tricycle drivers, small construction workers, and home-based industries and services. So we have here self-earning individuals or individuals who render services or sell goods as a means of livelihood outside of an employer-employee relationship or as a career. This includes professional practitioners including but not limited to doctors, lawyers, engineers, artists, architects, and the like. Businessmen, entrepreneurs, actors, actresses, and other performers, news correspondents, professional athletes, coaches, trainers, and other individuals. Filipinos with dual citizenships are Filipinos who are also citizens of other country. So for naturalized Filipino citizens, those who have become Filipino citizens through naturalization as governed by Commonwealth Act number 473 or the revised naturalization law. And lastly, citizens of other countries working and or residing in the Philippines. Foreign citizens with valid working permits and or alien certificate of registration or ACRs working and or residing in the Philippines. And now let us proceed for the registration procedure of informal economy members. So step 1 is to visit any of the local health insurance offices or PhilHealth Express outlets nationwide. Step 2 is to fill out 2 copies of the PhilHealth member registration form or PMRF, and step 3 is to submit PMRF to the LHIO or PhilHealth Express, and step 4 await member data record or MDR and PhilHealth ID card. And lastly, step 5, pay the necessary premium contribution using your PhilHealth ID number. So for the schedule of payments of the informal economy members, we have here monthly, pay until the last working day of the month being paid for, and quarterly, pay until the last working day of the quarter is paid for, and semi-annual is pay until the last working day of the first quarter of the semester is paid for, and annual, which is pay until the last working day of the first quarter of the year is paid for. So for example, in monthly we have here month is January, deadline is January 31. For quarterly, we have here January to March and deadline is March 31. For semi-annual, we have here period January to June and the deadline is March 31. And for annual is period January to December and deadline is March 31. And now let us move on to the lifetime members and its eligibility criteria. So for number 1, it is individuals aged 60 years and above and have paid at least 120 monthly contributions with PhilHealth and the former Medicare programs of SSS and GSIS. Number 2 is uniformed personnel aged 56 years and above and have paid at least 120 monthly contributions with PhilHealth and the former Medicare programs of SSS and GSIS. And third is SSS underground minor retirees aged 55 years above and have paid at least 120 monthly contributions with PhilHealth and the former Medicare program of SSS and GSIS. And lastly, SSS and GSIS pensioners prior to March 4, 1995. So now we have here sponsored members, and their qualified members are number 1, members of the informal economy from the lower income segment who do not qualify for a full subsidy under the means test rule of the DSWD, whose premium contributions shall be subsidized by the LGUs or shall be through cost sharing mechanisms between or among LGUs and or legislative sponsors and or other sponsors and or the member, including the national government. We also have orphans, abandoned, children who have no known family willing and capable to take care of them and are under the care of the DSWD, orphanages, churches, and other institutions, and abused minors, out-of-school youths, street children, persons with disability, senior citizens, and battered women under the care of the DSWD or any of its accredited institutions run by the NGOs or any non-profit private organization whose premium contributions shall be paid by the DSWD. And third one is barangay health workers, nutrition scholars, barangay tandas, and other barangay workers and volunteers whose premium contributions shall be fully borne by the LGUs concerned. And now we have here unenrolled women who are about to give birth, whose premium contributions shall be fully borne by the national government and or LGUs and or legislative sponsors or the DSWD if such woman is an indigent as determined by its through the means test. And now let us move on to the senior citizens and its qualified members. So number 1 is Filipino citizens who are resident of the Philippines aged 60 years and above and are not currently covered by any membership category of PhilHealth. Number 2 is qualified dependents of senior citizen members who are also senior citizens themselves. And lastly, qualified dependents of members belonging to other membership categories with or without coverage who are senior citizens themselves. For the registration procedures of the senior citizens, number 1 is through Office for the Senior Citizens Affairs or OSCA. Your step 1 is to fill out 2 copies of PhilHealth Member Registration Form or PMRF. Step 2 is submit duly accomplished PMRF to the OSCA and the city or municipality where the elderly reside. Step 3 is await member data record and identification card issued by PhilHealth through OSCA. Number 2 is through PhilHealth Local Health Insurance Office or LHIO. So step 1 is to fill out 2 copies of the PhilHealth Member Registration Form or PMRF, and step 2, attach one by one photo taken within the last 6 months. Step 3 is present a senior citizen's identification card issued by the OSCA in the city or municipality where the elderly reside, or a valid government issued ID. Step 4 is submit duly accomplished PMRF, and step 5, await member data record and PhilHealth identification card. So the senior citizen premium contribution. The premium contributions of those who will be enrolled under the senior citizen category shall be sourced from the proceeds of Republic Act number 10351, commonly known as the Syntax Law. And lastly, for the benefit availment of the senior citizens, in hospitals with installed HCR portal, senior citizens only need to present their senior citizen card, MDR, or any acceptable proof of identity and age. The hospital shall print a PhilHealth Benefit Eligibility Form or PBF. A PBF that says yes means that the patient is entitled to the benefits and shall serve as a basis for automatic deduction. So in case the hospital has no HCI portal installed, or the PBF says no, or the senior citizen was not able to enroll before discharge, the following should be attached to the usual claim documents. So number 1, duly accomplished PhilHealth Member Registration Form or PMRF, and number 2, acceptable proof of status as a senior citizen, including but not limited to the senior citizen's identification card.
As you can see on the slide, we will now be talking about the latest table of PhilHealth contributions from employees and employers, OFWs, and kasambahays. First, we will talk about the latest contribution table of employees and employers. Last January 2023, PhilHealth implemented the new premium contributions of the employed members. Before, there were a total of 28 salary brackets from 8,999 and below up to 35,000 and above. Each bracket has a different contribution rate. However, the new PhilHealth premium contribution rate this 2023 is fixed up to 4.50% of the monthly basic salary, which is to be equally shared by employers and employees. This comes with a salary floor of 10,000 pesos and a ceiling of 90,000 pesos. The total monthly premiums of employed members are being shared 50-50, which means 50% for the employer and 50% for the employee. For employed members of PhilHealth, this means that if your salary is 20,000 pesos, the 4.5% of 20,000 pesos is 900 pesos. The 900 pesos is your total monthly contribution. However, you don't have to pay for the whole amount since this shall be shared equally by your employer and yourself. You just have to contribute 450 pesos and your employer's counterpart is also 450 pesos, a total of 900 pesos. Now, let's talk about the OFW's PhilHealth contributions. The OFW premium for 2023 remains at 4%. The computation solely takes Philippine pesos into account. For OFWs to determine their contribution, they must multiply their monthly premium by 12. So let us say that if an OFW's monthly salary is 10,000 pesos, to determine the contribution, we must multiply the monthly salary of 10,000 pesos by 4% and get a product of 400 pesos. That 400 pesos must be multiplied by 12 to determine the total annual contribution. So, 400 pesos multiplied by 12 will get a product of 4,800 pesos, which can be seen on the table. However, you are not required to pay this in full. Before leaving the country, you will pay the required down payment. The remaining balance can then be paid in installments every 3 months, every 6 months, or once a full year has passed. To ensure proper computation, PhilHealth may ask land-based OFWs to submit their work contract from abroad. If not, their premiums will be automatically calculated using the highest rate. Lastly, we'll talk about the kasambahays. The PhilHealth contribution rate and computation for kasambahays are the same as those for formally employed members. Employers of home workers who make less than 5,000 per month are expected to make a full payment to PhilHealth on their behalf. Kasambahays who make more than 5,000 pesos per month must share the cost of their monthly contribution in half with their employers. Now, let's talk about the total number of PhilHealth members for the last 3 years, which includes the year 2020, 2021, and 2022.
As of December 31, 2020, the table has shown that for the contributors which are inclusive of privately employed individuals, government employed individuals, informal or self-earning individuals, OFWs or migrant workers, lifetime members, Filipinos with dual citizenship, kasambahay, family drivers, enterprise owners, and others, has a total number of 30,716,059 members. 28,418,624 dependents, and a total number of 59,134,723 beneficiaries. Additionally, the table has shown that for indirect contributors, which are inclusive of indigents, or National Household Targeting System for Poverty Reduction, senior citizens, and sponsored programs, has a total number of 22,085,716 members. 14,779,317 dependents, and a total number of 36,865,033 beneficiaries. To sum it all up, for both direct contributors and indirect contributor membership category, the total number of members are 52,801,775, 43,197,981 for dependents, and 95,999,765 beneficiaries for the year 2020. According to the table, there were 32,624,039 members, 29,050,264 dependents, and 61,674,303 beneficiaries for direct contributors as of December 31, 2021. The table also reveals that there are a total of 22,032,506 members, 14,323,460 dependents, and 36,355,966 beneficiaries for indirect contributors. As a result, the total number of members increased up to 1,854,770 for both direct contributors and indirect contributor membership categories, giving a total of 54,656,545 members. The total number of dependents increased up to 175,743, making a total of 43,373,724 dependents, and the total number of beneficiaries increased up to 2,030,504, covering a total of 98,030,269 beneficiaries for the year 2021. Lastly, according to the table, there were 35,305,072 members, 29,794,054 dependents, and 66,054,126 beneficiaries for direct contributors as of December 31, 2022. The table also shows that there are a total of 23,721,597 members, 15,322,860 dependents, and 39,044,457 beneficiaries for indirect contributors, which includes indigents, senior citizens, and sponsored programs. As a result, the total number of members increased up to 4,370,124 for both direct and indirect contributor membership categories, giving a total of 59,026,669 members. The total number of dependents increased up to 1,698,190, making a total of 45,071,914 dependents, and the total number of beneficiaries increased up to 6,068,314, converting a total of 98,030,269 beneficiaries for the year 2022.
So now we will tackle the sanctions for employers who do not give their employees PhilHealth, since this is a right for all private and government employees. However, it is optional for self-employed persons, OFWs, and non-working spouses. So, as you can see here, it is required by the law for employers to provide PhilHealth coverage to their employees. This is under the Philippine National Health Insurance Act of 1995, and failure to comply with this act will result in fines and penalties, which will depend on the severity of the act and the number of employees affected. Now, there are three main sanctions that will be exercised if mishaps regarding PhilHealth are present between employer and employee, stated in the provision of the revised implementing rules and regulations of the National Health Insurance Act of 2013. The first one, which is Section 18D, states that the employer shall be held liable for reimbursement of payment of a properly filed claim in case the concerned employee or the dependents avails of program benefits. The second one is Section 178, which states that the employer shall be penalized with a fine of not less than 5,000 pesos multiplied by the total number of employees of the firm if they refuse to register or deduct contributions of employees. Lastly, Section 179 states that employers shall be punished with a fine of not less than 5,000 pesos, but not more than 10,000 pesos, multiplied by the total number of employees of the firm if they fail to remit the employee's contribution to the corporation within 30 days from due date. So moving on, now since employees and availants need to remit their contributions, there are a multitude of third-party options available to accept these payments, which are accredited and authorized by PhilHealth. Now, the five main accredited payment centers in the Philippines are, of course, the PhilHealth office and branches, banks, Bayad centers, SM payment counters, and other payment centers. So, all of these are available nationwide with multiple branches in order to become accessible and convenient for people to remit their contributions. So as you can see here are the examples of specific payment centers for PhilHealth. It is divided into local and overseas collections. So the local collections are divided further into two, which are the over-the-counter collection system, where availants need to personally visit the payment centers. And the second one is the online collection scheme, where availants may simply pay online anytime, anywhere, but of course before a certain deadline. On the other hand, the overseas collections mainly prioritize over-the-counter collections in order to guarantee the safety of the remittance. So let us now move on to the actual steps needed to fill up forms in order to utilize PhilHealth benefits upon arriving at the hospital and confinement. So as you can see here, there are five general steps that you need to take, which are first, to notify the hospital staff that you are a PhilHealth member and that you will be using your PhilHealth benefits. The second one is where you need to submit your PhilHealth ID or any valid ID that indicates your PhilHealth number. The third one is you must fill out and sign the PhilHealth Claim Form 1 and the Claim Form 2, also including the PhilHealth Member Registration Form, which is the PMRF, if you haven't done so already. The fourth one is to ask a family member or a hospital staff member to assist you if you are unable to fill out the forms yourself or if you are not confident to fill it out on your own. So the last one is to wait for the hospital to submit the forms and other requirements to PhilHealth. So upon arrival at the hospital or medical center of choice that honors PhilHealth benefits, there are three elements regarding filling out forms. The first one is to fill out the general guidelines to all claim forms, which contains 8 steps or important notes. So the first one is to accomplish and submit Claim Form 1 and Claim Form 2 for all applications except for abroad confinement. The second one is to only use capital letters, to check appropriate boxes, and only use a ball pen or a sign pen. The third one is that names should start with last name, first name, and middle name and should be separated by a comma. And in case of extensions, it will be placed after the first name. Number 4 is that dates should be filled out following the month, day, and year format. Fifth, time should be filled out with the hour-minute format and using the 12-hour convention. For number 6, the PhilHealth identification number and the PhilHealth employer number should be filed out or filled out following the 291 format. Seventh is the PhilHealth accreditation number for institutions and professionals should be filled out using the format as you can see here in the PowerPoint. And lastly, the supporting documents and the CF1 and CF2 should be filed within 60 days from date of discharge. The second element involves filling out the CF1 and CF2 forms. As you can see here, the CF1 contains two parts. So the first part is the member and patient information, which requires information about the member and patient, of course, to ascertain the identity of the member or patient or dependent for eligibility for PhilHealth benefits. While the second part provides the basic information about the employer and contains the certification of qualifying contributions and the correctness of the information supplied by the member. On the other hand, the CF2 is divided into 5 parts, containing the healthcare provider information, the drugs and medicines used, the X-ray laboratory supplies and others, the certification of institutional healthcare provider, and lastly is the consent to access patient records. Now here are pictures on what the forms look like for you to familiarize with it. So this is for the CF1 form, and these are for the CF2 forms. Now, the last element is the PhilHealth Member Registration Form, or the PMRF, which is a form to request your health insurance here in the Philippines. So here we have 17 steps or reminders when filling up the said form. So number 1, information should be written in capital letters as well. And if information is not applicable, just write N/A. For number 2, all fields are mandatory, meaning it should be filled out completely unless there are indications where some information to be input is optional. Number 3, there must be a proof of identity for first-timers or supporting documents between member and dependents for updating or requests. Number 4, make sure to check the appropriate boxes if purpose is for registration, updating, or amendment. So for number 5, state the preferred consulta provider near your place of work or your residence. For number 6, follow this format when inputting your name, starting with, again, the last name, followed by the first name, followed by the name extension if there is any, and then the last one is the middle name. Number 7, you must indicate the registrant's or member's name as it appears in their birth certificate. For number 8, you must indicate your mother's maiden name. Number 9, you must indicate the full name of your spouse if the registrant or the member is married. For number 10, you indicate the complete permanent and mailing addresses and contact numbers. 11, of course, we need to check the appropriate box to be updated or amended and indicate, of course, the correct and accurate data. For number 12, we need to check the appropriate box which best describes your current membership status. 13, indicate the profession, monthly income, and proof of income to be submitted for direct contributors. 14, indicate the actual monthly income for self-earning individuals, for kasambahays, and for family drivers. 15, you must provide the full name of the living spouse, children below 21 years old, and parents who are 60 years old and above declaring dependents. Number 16, The dependents with disability shall be registered as principal members in accordance with the Republic Act 11228 on mandatory PhilHealth coverage for all persons with disability. And last but not the least, number 17, the registrant must affix his or her signature over printed name or right thumb mark if unable to write, and indicate the date when the form was signed. So the process sounded extremely long, but as you can see here, it only takes 2 pages to fill out. So don't be intimidated by the 17 steps aforementioned, because as long as you are familiar with what needs to be indicated, and of course you know yourself or the person that you are filling the form for, then it would be a breeze to answer or to fill out.
Institutional providers can apply for accreditation anytime. For hospitals, ASC and FSDCs can apply for renewal on January 1 to 31 of the succeeding year, and for OPB, maternity care, and anti-TB package providers can apply for renewal on September 1 to 30 of the current year. PhilHealth shall now accept applications for renewal of accreditation of health facilities until December 31, 2022. They shall provide ample time for corporation to deliberate and decide on the application and to ensure the continuous processing of claims. The following shall serve as guide to health facilities applying for renewal of their continuous accreditation for calendar year 2023. Number 1. Health facilities shall submit the applications by mail, courier, or walk-in of original documents or via email of scanned documents to their respective PhilHealth regional offices and our local health insurance offices. Number 2. The original documents of applications submitted via email shall be submitted within 30 calendar days from the date of online submission. Number 3. Only applications with complete requirements will be accepted and processed. Incomplete applications shall be returned with a corresponding notice of deficiency lies. Number 4. Ensure that the accreditation of head facility is valid during the accreditation period. Apply for accreditation of head facility is set expired on the first quarter of calendar year 2023. The healthcare professional shall likewise submit an application for renewal of accreditation together with the application of the health facility. Number 5. All health facilities shall ensure updated remittance of premium contribution of their employees to PhilHealth. Number 6. For the 2023 accreditation cycle, the accredited health facilities may submit their audited financial statement for calendar year 2022 on or before June 30, 2023 as applicable. Number 7. Applications for initial of re-accreditation may be filed anytime. Requirements or documents are available at the PhilHealth website. Number 8. The Provider Data Record or PDR and the Performance Commitment or PC may be downloaded from the PhilHealth website. On this slide, this is the Provider Data Record or PDR, and on this slide, this is the Performance Commitment or PC. Again, these accreditation documents can be downloaded at PhilHealth website under Accreditation Documents.
Level 3 hospitals are considered to be tertiary hospitals that can provide all kinds of health services. The Philippines currently has 117 Level 3 hospitals, and the following are the ones within Cebu: Cebu Orveles General Hospital Incorporated, Cebu Doctors University Hospital Incorporated, Chonghua Hospital Mandaue, Perpetual Socorro Hospital of Cebu, Southwestern University Medical Center, University of Cebu Medical Center Incorporated, Vicente Soto Memorial Medical Center, and Visayas Med Cebu. On the other hand, Level 2 hospitals provide basic health services alongside ICU facilities for critically ill patients and specialist doctor for gynecology and pediatric services. The Philippines currently has 348 Level 2 hospitals, and the following are the ones within Cebu: Adventist Hospital Cebu Incorporated, Allegiant Regional Care Hospitals Incorporated, Allied Care Experts Medical Center Cebu Incorporated, Amusop Siemens Hospital Incorporated, Cebu City Medical Center, Cebu North General Hospital Incorporated, Cebu South General Hospital Incorporated, Cebu South Medical Center, Maayo Medical Clinic Corporation, Mactan Doctors Hospital Incorporated, Mendero Medical Center Incorporated, and finally St. Vincent's General Hospital Cebu Incorporated. Lastly, Level 1 hospitals provide emergency care and treatment, general administrative and ancillary services, primary care of prevalent diseases in the locality, and clinical services such as general medicine, pediatrics, obstetrics, and non surgical gynecology and minor surgery. The Philippines currently has 775 Level 3 hospitals, and the following are those within Cebu: Bogo Medellin Medical Center, Camp Lapu-Lapu Station Hospital, Cebu Provincial Hospital Balamban, Cebu Provincial Hospital Carcar City, Cebu Provincial Hospital Danau City, Cebu Provincial Hospital Bogo City, Cebu Periculture Center and Maternity House Incorporated, Diaperin Community Hospital, Eversley Child Sanitarium and General Hospital, Lapu-Lapu City Hospital, St. Anthony Mother and Child Hospital, and Toledo City General Hospital. The following are schedule of application fees for institutional healthcare providers. For level 1 hospitals, its initial and reaccreditation is 3,000. For renewal before the prescribed filing period with 10% incentives is 1,800. For renewal during the prescribed filing period, it's 2,000. Reaccreditation 30 to 90 days prior to expiration is 4,000, and 1 to 30 days prior to expiration is 8,000. For level 2 hospitals, its initial and reaccreditation is 5,000. Renewal before the prescribed filing period is 3,600. Renewal during the prescribed filing period is 4,000. Reaccreditation 30 to 90 days prior to expiration is 8,000, and reaccreditation 1 to 30 days prior to expiration is 16,000. For level 3 hospitals, initial and reaccreditation is 8,000. Renewal before the prescribed filing period is 7,200. Renewal during the prescribed filing period is 8,000. Reaccreditation 30 to 90 days prior to expiration is 16,000. And reaccreditation 1 to 30 days prior to expiration is 32,000. For level 2, level 4 hospitals with training programs, initial and reaccreditation is 10,000. Renewal before the prescribed filing period is 9,000. Renewal during the prescribed filing period is 10,000. Reaccreditation 30 to 90 days prior to expiration is 20,000, and reaccreditation 1 to 30 days prior to expiration is 40,000. For ambulatory surgical center, initial and reaccreditation is 5,000. Renewal before the prescribed filing period is 3,600. Renewal during the prescribed filing period is 4,000. Reaccreditation 30 to 90 days prior to expiration is 8,000, and reaccreditation 1 to 30 days prior to expiration is 16,000. For freestanding dialysis center, initial and reaccreditation is 5,000. Renewal before the prescribed filing period is 4,500. Renewal during the prescribed filing period is 5,000. Reaccreditation 30 to 90 days prior to expiration is 10,000. And for reaccreditation for 1 to 30 days prior to expiration is 20,000. For OPB providers and TB DOTS providers, initial reaccreditation is 1,000. Renewal before the prescribed filing period is 900 pesos. Renewal during the prescribed filing period is 1,000. Reaccreditation 30 to 90 days prior to expiration is 2,000, and reaccreditation 1 to 30 days prior to expiration is 4,000. For non-hospital maternity care providers, initial reaccreditation is 1,500. Renewal before the prescribed filing period is 900. Renewal during the prescribed filing period is 1,000. Reaccreditation 30 to 90 days prior to expiration is 2,000, and reaccreditation 1 to 30 days prior to expiration is 4,000. For 3-in-1 providers and OPP and DOTS providers, initial reaccreditation is 1,000. Renewal before the prescribed filing period is 900. Renewal during the prescribed filing period is 1,000. Reaccreditation 30 to 90 days prior to expiration is 2,000. Reaccreditation 1 to 30 days prior to expiration is 4,000. For OPB and MCP providers, initial reaccreditation is 1,500. Renewal before the prescribed filing period is 1,350. Renewal during the prescribed filing period is 1,500. Reaccreditation 30 to 90 days prior to expiration is 3,000. And reaccreditation 1 to 30 days prior to expiration is 6,000. For MCP and DOS providers, initial reaccreditation is 1,500. Renewal before the prescribed filing period is 1,350. Renewal during the prescribed filing period is 1,500, reaccreditation 30 to 90 days prior to expiration is 3,000, and reaccreditation 1 to 30 days prior to expiration is 6,000.
Moving on to free PhilHealth benefits. This category belongs to persons who have no visible means of income or whose income is insufficient for family subsistence as identified by the Department of Social Welfare and Development or DSWD based on specific criteria. All indigents identified by the DSWD under the National Household Targeting System or NHTS for poverty reduction and other such acceptable methods shall automatically be enrolled and covered under the program. The following are qualified dependents that can enjoy PhilHealth coverage without additional premiums: legitimate spouse who is not a member, child or children that are legitimate, legitimated, acknowledged, and illegitimate, adopted, or stepchild or stepchildren below 21 years of age, unmarried and unemployed. Children who are 21 years old or above but suffering from a congenital disability, either physical or mental, or any disability acquired that renders them totally dependent on the member for support as determined by the corporation. To continue, foster child as defined in Republic Act 10165, otherwise known as the Foster Care Act of 2012, parents who are 60 years old or above, not otherwise an enrolled member whose monthly income is below an amount to be determined by PhilHealth in accordance with the guiding principles set forth in the NHI Act of 2013, and parents with a permanent disability regardless of age as determined by PhilHealth that renders them totally dependent on the member for subsistence. Also, qualified dependents shall be entitled to separate coverage of up to 45 days per calendar year. However, the 45 days allowance shall be shared among them. Although the aforementioned qualified dependents must be declared by the principal member, their names must be listed under the principal member's member data record or MDR to ensure hassle-free benefits are availed. Now, to be eligible for PhilHealth benefits, members should have paid at least a total of 9 months of premium contributions within the immediate 12-month period prior to the first day of confinement. The 12-month period is inclusive of the confinement month. Indigent families can avail of health insurance coverage under the sponsored program. The sponsored program is open to qualified indigents belonging to the lowest 25% of the Philippine population. Also qualified under this program are families who are listed in the National Household Targeting System for Poverty Reduction or NHTSPR of the Department of Social Welfare and Development. In regards to premium for qualified indigents, the sponsored program is being made possible through the partnership of PhilHealth and sponsors such as LGUs or local government units, private individuals and corporations, and members of Congress, and among others. The national government, through PhilHealth and the above-mentioned sponsors, jointly pay the annual premium for each enrolled family. Now, the following are benefits covered by PhilHealth. Inpatient benefits are paid to the Accredited Healthcare Institution, or HCI, through all case rates. The case rate amount shall be deducted by the HCI from the member's total bill, which shall include professional fees of attending physicians prior to discharge. The case rate amount is inclusive of hospital charges and professional fees of the attending physician. As for outpatient benefits, day surgeries or ambulatory or outpatient surgeries are services that include elective or non-emergency surgical procedures ranging from minor to major operations where patients are safely sent home within the same day for post-operative care, also including radiotherapy, hemodialysis, and outpatient blood transfusion. Payments for these procedures are made to the accredited facility through all case rates. The same with inpatient benefits. The case rate amount shall be deducted by the HCI from the member's total bill, which shall also include professional fees of attending physicians prior to discharge. Proceeding to Z benefits, we have the following benefit package: acute lymphocytic or lymphoblastic leukemia, breast cancer, prostate cancer, end stage renal disease eligible for including kidney transplantation, and coronary artery bypass graft surgery. To continue, Z benefits also include surgery for tetralogy of Fallot in children, surgery for ventricular septal defect in children, cervical cancer, which includes chemoradiation with cobalt and brachytherapy or low close or primary surgery, and chemoradiation with linear accelerator and brachytherapy. We also have Z-Morph, or Mobility Orthosis Rehabilitation Prosthesis Help, that also includes first right or left below the knee and both limbs. We also have Expanded Z-Morph, which includes prosthesis. To continue on Expanded Z-Morph, we have ortho or prosthesis, orthosis, and spinal orthosis. We also have selected orthopedic implants, implants for arthroplasty, and implants for hip fixation. We also have implants for pertrochanteric fracture and implants for femoral shaft fracture or tibial fracture. Still, for Z benefits, we have PD first, which is for end-stage renal disease requiring peritoneal dialysis. We have colon and rectum cancer. We also have preoperative clinical stage 1 with post-operative pathologic stage 2 to 3 using linear accelerator as mode of radiotherapy and using cobalt as mode of radiotherapy, and clinical stage 2 to 3 using linear accelerator as mode of radiotherapy and using cobalt as mode of radiotherapy. We also have C benefits for premature and small newborn for prevention and preterm delivery.
Still under Z benefit, it has preterm and small newborns under 24 to 32 weeks and also under 32 to 37 weeks. It also has children with developmental disabilities with assessment and discharge assessment and rehabilitation therapy session. Another is children with mobility impairment with requiring assistive devices and requiring seating device, basic and intermediate wheelchair, and also yearly services and replacement of devices. Another is children with visual disabilities with initial assessment and intervention for Category 1 visual impairment and initial assessment and intervention for Categories 2, 3, and 4 in visual impairment. It also has package code and rates for initial assessment and intervention. Here are description for add-ons and other benefits. Another is children with hearing impairment. Under here, we have habilitation and the description for assessment and habilitation of children 3 to less than 6 years old at the time of pre-authorization. Under here is the description for assessment and habilitation of children 6 to less than 18 years old at the time of approval of pre-authorization. Here is the description for hearing aid replacement. And lastly is the replacement of hearing aid for severe to profound hearing loss 5 to less than 18 years old. Lastly, for SDG related, it has outpatient malaria package, outpatient HIV/AIDS package, outpatient anti-tuberculosis treatment, voluntary surgical contraception procedures, and lastly, animal bite treatment package.
And now to close off today's presentation regarding PhilHealth and the PhilHealth membership specifically, I will be giving a summary of everything that we were able to discuss. So, starting with the first part, which is the PhilHealth membership and contribution, we were able to discuss Republic Act 7875, which is essentially the foundation or the cornerstone for the existence of PhilHealth and as well institutionalizes the national health insurance program as well as includes and talks about the functions and powers of PhilHealth. So this is the very foundation of PhilHealth's existence, essentially. Then we were also able to talk about the types and categories of memberships. So out of the different kinds we were able to discuss, these are the six most important ones. formal economy, informal economy, lifetime members, senior citizen, indigent members, and sponsored members. And of course, the registration process on how to register to become a PhilHealth member. And the registration process may differ slightly depending on what kind or where what sector you are from and what kind of membership you will have and the like. So for example, those who are formal employees will have a slightly different kind of registration process from indigent members or sponsored members, for example. But the basic registration process that you will have to undergo is to fill up the PMRF or the PhilHealth member registration form. And afterward, we were able to discuss regarding PhilHealth members and memberships, specifically two parts: the latest table of PhilHealth contribution and the total number of PhilHealth members for the last 3 years. So, regarding the latest table of PhilHealth contribution, this talks about the rate or the premium rate at which the PhilHealth members will have to pay. So, essentially, the percentage of their wage or of their salary that they will have to pay for their PhilHealth membership. That's what the latest table of PhilHealth contribution essentially talks about. And since this is the latest table, then this is what we are currently following. Then the total number of PhilHealth members for the last 3 years, we were able to discuss the breakdown of the number of the members and where these members belong, the different kinds of sectors, and the like. We're also able to discuss the sanctions for employers who don't give PhilHealth contributions to their employees for their employees' PhilHealth memberships. So again, this is required by law under the Philippine National Health Insurance Act, and such employers might or can receive fines and penalties for their failure to give PhilHealth to their employee or to give PhilHealth contributions for their employees' PhilHealth membership. Of course, we are able to talk about the accredited payment centers for remittances of PhilHealth contribution. So where people can go to be able to pay their PhilHealth membership or their PhilHealth contribution. And we were able to discuss different kinds of accredited payment centers, but basic overview of those would be PhilHealth offices and branches, so regional branches, the different kinds of branches all around the Philippines, banks, Bayad centers, SM payment counters, and other such payment centers. So there are many different kinds, but those are the basic ones or the basic types. And lastly, under this portion, we were able to discuss what to do upon hospital confinement and as well as the forms that you will have to fill up if you are a PhilHealth member. So if you are a PhilHealth member, for example, and you were confined to the hospital, first you'll have to notify the hospital that you are a PhilHealth member and that you would like to use your PhilHealth benefits. So you show proof that you are a PhilHealth member, and ways to show proof is to show your PhilHealth ID or any ID that can show your PhilHealth number. Then afterward, the forms that you'll have to fill up would be the PhilHealth Claim Form 1 or CF1, Claim Form 2 or CF2, and the PhilHealth Member Registration Form or the PMRF if you haven't done so already. So if you have yet to fill these forms up, then you will have to do so. Then, of course, we were also able to talk about the specific guidelines when it comes to utilizing your health benefits, especially if you were confined to the hospital. So, this is for the first part, PhilHealth membership and contribution, where essentially we were able to talk about the a basic overview of what PhilHealth membership is, the different kinds of members, the registration process, how to go about becoming a PhilHealth member, and other such relevant details. So moving on, the second part is about the PhilHealth Healthcare Institutional Accreditation. So for this part, we were able to talk about the details on healthcare institutional accreditation. So specifically when institutional providers can apply for accreditation, and this is anytime. They can apply for accreditation anytime.
And so long as they meet the requirements and criteria set by PhilHealth, then they can become an accredited healthcare institution. And we were also able to talk about the renewal for accreditation as well as continuous accreditation for the calendar year 2023, and the relevant documents required for the continuous accreditation, it would be the provider data record or the PDR and the performance commitment or the PC. And we were also able to discuss the list of PhilHealth accredited hospitals. So of the examples that we gave a while ago, those were specifically the PhilHealth accredited hospitals, level 3, level 2, level 1, that were based in Region 7, based in Cebu. But for the overall, there is a long list of these different kinds of hospitals. So for example, for level 3 hospitals, there are 117 that are PhilHealth accredited. For level 2 hospitals, there are 348 that are PhilHealth accredited. And for level 1 hospitals, there are 775 that are PhilHealth accredited. And lastly, we were able to talk about, for this portion, the schedule of application fees for institutional healthcare providers. So essentially, the different breakdown for application fees for applying to become an accredited healthcare institution. And this is for the second part, which is about PhilHealth healthcare institutional accreditation, how to be accredited, when you can be accredited, and the list of the different accredited hospitals. So, moving on to the last and final portion that we were able to talk about today, it would be regarding the PhilHealth benefits. So there are three major parts we were able to cover. The first is free PhilHealth membership, or how you can receive free PhilHealth membership. And you can do so by being a beneficiary of a person or of a current PhilHealth member. And the requirements to become a beneficiary is you have to be a legitimate spouse, for example. So a legitimate spouse who doesn't have a PhilHealth membership and your spouse has a PhilHealth membership, then you can become a beneficiary to your spouse. Or if you are a child or children, whether legitimate, acknowledged, illegitimate, adopted, and the like, so long as you are below 21 years old, then you can become a beneficiary to someone who has PhilHealth membership. And if you are a child or children, if you are a child or children and you are above 21 years old, but according to the law, you are still dependent to your parents because you might have some sort of disease which renders you unable to become independent of your parents, then you can still be a beneficiary. And there might be other prerequisites as well, can be applicable to become a beneficiary. And we were able to talk about availing of health benefits, and specifically how to avail for health benefits for members, for indigent groups, and for those who are sponsored members. So for these different kinds of members, we were able to discuss how to be able to avail, how to be able to get your health benefits. And lastly, we were able to talk about the coverage of the PhilHealth benefits. So specifically, up to where these benefits support you, up to where will they cover. So there are three major parts: the inpatient benefits, outpatient benefits, and the Z benefits. And we were able to talk in depth about these different benefits, these different portions, and the specific breakdown on just how much you will be able to be benefited for this kind of disease, for example, and the like. And that would be it for our group's PhilHealth discussion regarding PhilHealth and PhilHealth membership. And of course, we would like to give our dearest and most sincere gratitude to Miss Dina Marie Sanchez, who we were able to interview regarding this topic, and we were able to ask questions regarding the PhilHealth membership. And with that said, this is it. Thank you very much for being patient enough to listen to us and for allowing us to talk about and discuss PhilHealth and the PhilHealth membership with all of you. With that said, if you have any questions, then we are free to entertain them and you may ask them now. Thank you very much.
So thank you very much. We're now open. We're now opening the floor to questions. So if you have any questions, you can just raise your hand and we can cater to them right now. Thank you. And of course, don't forget to state the cluster that you're from. Okay, MCJ has a question. MCJ.
Hi, am I heard? Hello.
Hello, hello. Yeah, yeah. We can hear you, lang.
Okay, so I'm MCJ Arbukog from Cluster 5. So my question is, can a member who is overdue in their payment still pay and retrieve their benefits?
Hello. So, thank you for that question. So, when it comes to members who are overdue in their payments, actually, in the past, PhilHealth would not accept overdue payments, and there was a penalty that they gave for people who paid like overdue payments, right? However, currently, this has already been revised due to the pandemic and the revisions in the law. So, as of right now, members can still pay their overdue payments and they can retrieve their benefits, and PhilHealth will be asking the members to pay their previous overdue payments. So I hope that answered your question.
Okay, thank you so much.
Thank you. Okay, Isabella can go next.
Wonderful presentation, Cluster 1. Now, I'm Isabella Parrish from Cluster 3, and my question is it possible for existing PhilHealth members to use at the same time their PhilHealth benefits and their private health insurance plans?
Okay, hi Isabella, thank you for that question. Yes, this is legal and would benefit the members since you can allocate one health insurance to cover a different area of your medical needs at the exact moment. Exact moment. This is known as the dual coverage, which is allowed under the Philippine Universal Healthcare Law or the Republic Act 11223 to give the individual endless options for health benefits.
Thank you.
Okay, we can have Queenie next.
Hi, Cluster One. Very informative video. My question is, how long does it take for the PhilHealth benefit to be posted on your hospital bill? By the way, I'm from Cluster 4.
Joshua,
Hello,
you can stop
Queen.
sharing na sa screen.
Okay, miss. Queenie, can you repeat your question lang again? From cluster 4, right?
Yes, my question is, how long does it take for the PhilHealth benefit to be posted on your hospital bill?
Hello, Queenie. To answer your question is, if you're hospitalized and you will not see your billing statement, it will already be posted. And in case of dengue, a not so severe dengue case gets a case rate of 10,000 pesos. So posting your hospital bill is 20,000 including the professional fee of your doctor, then the 20,000 pesos will be deducted from the 10,000 pesos dengue case rate. So overall, once you receive your billing statement and you're a member of PhilHealth, all you have to pay is the excess from what PhilHealth has covered. And I hope I answered your question.
Yes, you did. Thank you very much, Cluster 1.
Okay, we can have someone else. I think we haven't had yet from cluster 2. So if someone from cluster 2 can ask their question, we can entertain that.
Okay, so good morning, Cluster 1. I am Claudio Joaquin G. Echeverria, and I am from Cluster 2. So my question is, are there any specific health conditions or illnesses that are not included from the PhilHealth coverage?
So hello, Dio. Great question because we actually asked that to Miss Sanchez, and Miss Sanchez told us that there are certain procedures that are not included in the PhilHealth coverage, and those are drug and alcohol rehabilitation, and there is also long-term mental health care, and also some routine eye exams like getting eyeglasses or contact lenses, and some cosmetic or aesthetic procedures like getting rhinoplasty, and some routine dental exams. However, PhilHealth does cover some cataract surgery for your eyes and dental services such as tooth extraction, and that is only for infected teeth and some wisdom tooth removal. So yeah, I hope I answered your question.
Yes, you did, Miss Tulibao. Thank you for answering.
Okay, thank you. So we can have a few more questions since we still have a bit of time. We can have Joanna.
Good afternoon, Cluster 1. Wonderful presentation, by the way. So I'm Joanna Marie Bajang from Cluster 3, and here is my question. Is it possible for an indigent or a person who suffer from extreme poverty to be registered for PhilHealth upon confinement?
Hello, Joanna. So the answer to your question is yes, it is possible. So PhilHealth has a program specifically made for these instances, and the program is called Point of Service Program. So here, the indigent or financially incapable person, as they call it, has been admitted to a hospital, and their status will be assessed and will be registered to PhilHealth then and there. So I hope that answers your question. Thank you.
Thank you,
Okay,
Emily.
thank you. Thank you. So we can have Jana next for her question. I don't think Jana will be asking a question, so maybe Chris. Oh, Jana, yeah.
Hello, good afternoon, Cluster One. I just want to congratulate you for your successful presentation. I am Jana Cassandra Zero Blair from Cluster 4, and my question is it possible to have health insurance other than PhilHealth? So, hello, Jana. Yes, it is possible to have both PhilHealth and another PhilHealth, a private health insurance. However, the posting of deductions is always PhilHealth first. PhilHealth benefits will be used as the primary coverage, while the private health insurance plans can be used as a secondary coverage to cover any remaining healthcare costs that are not covered by PhilHealth. The member can coordinate with both their PhilHealth accredited healthcare provider and their private health insurance provider to ensure that their benefits are maximized and properly utilized. I hope I answered your question.
Okay, thank you. Crizel, I think Crizel can ask her question. Yeah, Crizel, you can go ahead, ask your question. I think we can't hear you, Crizel. I don't think Crizel can be heard. Let's have Kendricks lang ask her questions for now, while Crizel tries to fix her microphone. Sige, go.
Good afternoon, Pastor Juan. Great presentation, by the way. So, my question is if both parents are PhilHealth members, is it possible for their child to be considered qualified dependents of both parents?
From what cluster are you, by the way, Ken?
I am from Cluster 2.
Sige, thank you.
Okay. I can. So, if both parents are PhilHealth members, a child can't be a qualified dependent of both parents who are PhilHealth members. However, if the parents have multiple children, they may divide which child will be their respective dependents. This practice is recommended by PhilHealth, especially in cases where the parents have more than one child. The parents may have multiple dependents, but the child may be a dependent to only one parent.
Okay, thank you.
sige, I think we're like almost time, so we can have like one last question na lang siguro. We can have like one last question from Riasha na lang, and then after that, I think that's it na.
Hello, Cluster One. Great presentation, by the way. So, I'm Rishonal Villangarin from Cluster 2. My question is, can a member request a return contribution even though he has already paid for the insurance and is unable to utilize it?
Okay, thank you, Riasha, for that question. So, once a member has already paid for their insurance, even if they haven't been able to utilize it, no. Once a member has paid for their PhilHealth insurance, they can't request a refund or withdraw their payment. So this policy is in place. It's here to ensure na there are enough funds for PhilHealth to utilize. And if ever there are any withdrawals, if withdrawals were allowed, then there's the risk na all members can just withdraw their payments, diba? Like they can just keep withdrawing their payments. So this can lead to a shortage of funds. So this is to make sure lang na PhilHealth will still have funds na they can use.
Okay, thank
Sige.
you, Joshua.
Thank
How
you as
will
well,
you
Riasha.
know? How will you know that a certain hospital is PhilHealth accredited without looking at the list?
Um, for most hospitals, if they are PhilHealth accredited, they usually have like centers within their hospital wherein you can ensure that you are covered by PhilHealth. The hospital is covered by PhilHealth, and that they be able to apply your PhilHealth insurance to your bill.
Again, my question is, how will you know that a certain hospital is PhilHealth accredited without looking at the list or without asking anyone?
You're asking Miss how to identify Miss those hospitals na are accredited by PhilHealth, and
Yes,
you don't refer to the list
without
they
looking
have.
at the list and without asking anyone in that hospital.
Okay, Miss. Okay. Ano, Miss, the easiest way is to always just check lang the hospital or asking someone, especially if you're already in the hospital.
Diba,
Pero
I said
if
without
ever you don't,
asking anyone or
yes, Miss,
without
if ever you
looking at
don't
the list.
Yes, miss. If ever you don't look at the list or you don't ask anyone, then usually the process already, miss, is if ever you've already been hospitalized, the process will be that by the time the bill arrives to you, it's already going to be deducted already by your PhilHealth due to your PhilHealth
No, no, no.
insurance.
What if you are a newcomer in that particular place and there is an emergency and you will be sending someone to that hospital, but you don't know whether that hospital, the nearest hospital, is PhilHealth accredited or not?
In that case, miss, once usually in the main entrance of the hospitals and then the emergency entrances, there are signage that states PhilHealth. So if they have that signage, then that means that they are PhilHealth accredited outside of the hospital.
Correct. That is the answer that I've been waiting for. At the facade of the building, sa hospital building, naanay makabutang nga PhilHealth accredited. Try to see that in our hospitals here in Cebu City. Manotice ninyo nagingan nga PhilHealth accredited. Supposing for emergency cases, you send somebody to the government hospital. Maong ginay madali-dali dayon no for emergency cases like naay maligsan. Dadon dayon sa uh, Cebu City Medical Center kung within the city na hitabo ang accident, or kung it happened in the municipalities, then that will be sent to Vicente Soto Hospital. So the question now is, asa man bayaran ni PhilHealth nga maong hospital? Like for example, within the first 24 hours nga gida sa government hospital. And then ang tagtungod decided to transfer the patient to a private hospital. So asa man i-apply ang PhilHealth benefits? Asa man mo bayad si PhilHealth? Dito sa first hospital nga gidad-an or adto sa private hospital diin gitransfer ang patient?
Ano miss, where siya na admitted miss if inpatient for example kay there's like a set time kung when like a certain amount of hours na needed for the patient to be there in the hospital before ma-apply siya miss. So for example like 24 hours inya na miss. So usually where na admitted ang patient miss?
So you mean dito sa first hospital nga na-admit siya even if wala pa 24 hours? Niya gitransfer to a private hospital?
Ay dili miss, like kung where pa stay ang patient miss.
Kasi
Like
biyag kadiyot ang patient sa government hospital pero wala right 24 hours. So gitransfer sa tagtungod dito na sa private hospital. So asa man ang PhilHealth benefits ma-enjoy? Both hospitals? Only in the first hospital nga gidadaan sa patient? Or sa second hospital diin gitransfer si patient?
sa second hospital miss where na transferred ang patient. So sa private one miss sa example nim give.
Why in the private hospital?
Kay
Kay
inpatient. Sige, go.
kay para ma-accredited sa PhilHealth imong bill miss kay need nimo ma-admit within 24 hours. So if inpatient ra ka or emergency patient nya wala jud ka gi-pa-admit sa doctor kay imong bill dili siya dedekan sa PhilHealth.
Dili covered sa PhilHealth.
Yes,
So ang
miss.
tagtungod sa patient, bayaran niya ang
Ang
hospital
bill sa first
pilay
hospital.
na gasto diin siya una nahatod.
Yes,
Is that
miss.
the one? So ang sa PhilHealth dito na sa private hospital ma-apply.
Yes, miss, kung asa siya na-admit.
Correct. I agree with your answer. Kinsa to na ay pangutana lain? Wala na. Nakaas na ang 5 ka clusters, tanang cluster, non-reporting clusters.
Yes, miss, naka-ask na sila questions, miss.
Okay. So thank you, PhilHealth Cluster, for a job well done. You have shared that valuable information to us. And see you next meeting. Bye.
Goodbye and thank
Goodbye,
you,
miss.
Mel.
Thank you and
Goodbye,
goodbye,
Thank you,
miss. Goodbye,
miss.
Miss. Thank you
miss.
sa
Thank
clap
you and goodbye,
reaction.
everyone.